are our strings. Small, long, straight, complex links that tie us together. It's what makes us human. It's what separates us as complex beings. As a medical student, my life is full of stories. You wouldn't think so, given the stereotypically stern and calculated nature of my field. But stories are how I learn. Stories teach me what to recognize, what to investigate, what patterns to follow, and what conclusions to make. Most importantly, stories allow me to form connections with patients that no drug, no treatment plan, and no diagnostic tool can ever touch. But what happens when stories aren't told? When someone's experience is never recorded, their voice never fills a classroom, their messages never reach our future doctors, nurses, clinicians. When you fail to tell someone's story, you assign them to a box with limits. Those limits lead to generalizations, those generalizations lead to assumptions, and those evolve into stereotypes. That box isolates, dehumanizes, and reduces populations. We saw the brutal reality of this during the COVID-19 pandemic. Patients from ethnic minority backgrounds struggled to describe their symptoms in a system that didn't always understand them. Ethnic minority NHS staff were dying at disproportionate rates. Mistrust between patients and professionals grew, creating divides that dampen dialogues and cost lives. In medicine, we're taught to uphold one of our oldest values: do no harm. But how can we truly avoid harm when we live in a culture that silences the voices of some whilst amplifying the voices of others? Let me introduce you to a case. We've got a small girl called A. She's 12 years old, vibrant and curious, living in a small Cornish town. A's mother noticed patches of lighter skin on her arm, and after a quick consultation with the GP, she was dismissed as having eczema, for which she was prescribed a simple moisturizer. Months passed, and that patch grew. After further investigation, a dermatologist diagnosed her with vitiligo, a condition often missed on darker skin. This delay wasn't due to negligence, but a systemic lack of representation in medical education. But A's case is just one example. The consequences of this systemic gap can be even more devastating. Imagine this. You take your 6-month-old son to the GP. You explain that you're concerned about changes in his skin color. A doctor, unable to distinguish between a bruise and a birthmark on a child with darker skin, the scene ends with you being questioned and accused of abuse. Devastating, right? This is exactly what happened to Lakshmi Thapa in July 2024. A clinician unfamiliar with the commonly inherited blue-gray birthmark assumed child abuse. This isn't just a clinical mistake. This is a failure of education and representation. How many children like A are overlooked because their skin doesn't match the descriptions in medical textbooks? How many mothers like Lakshmi are wrongly accused of abuse due to a lack of recognition? 18% of images include non-white skin tones in leading medical textbooks. That was found in a study spanning over 25 years. Only 6 years ago, 5% of general medical texts were found to include darker skinned images. The result? Misdiagnosis, delayed diagnosis, and mistrust. 18, 25, 6, 5. I want you to remember these numbers because they represent gaps in medical education, gaps that can be fatal. As a medical student, I've observed these gaps firsthand. I remember sitting at the reception of a GP practice, and I noticed a small piece of paper hanging off of the desk. You could see here, they were describing the symptoms of Streptococcus A, a disease that was increasing in prevalence in the area. If I talk you through the quote, it says, includes a sore throat, headache, fever, along with a fine pinkish or red body rash and a sandpapery feel. On darker skin, it may be more difficult to detect, but will have a sandpapery feel. I couldn't help but wonder how many patients with darker skin would walk through that clinic door and feel understood, feel seen, and feel acknowledged by the clinicians they would interact with. These vague descriptions isolate patients of color. If we want equity in healthcare, we need inclusive language, inclusive textbooks, and inclusive teaching. There's a proverb I hold close to me. To help one is to help all of humanity. It was this belief that pushed me to create, to learn, and to grow, transforming fear, isolation, and hopelessness into action. So in the summer of 2023, I decided to create Skin for All, a website dedicated to ensuring everyone felt seen, heard, and respected. For me, this project was my love letter to humanity, a demonstration that anyone can make a change. I prioritized making the content accessible and relatable. I compartmentalized different areas of the website to simplify technical jargon for everyone, providing detailed information on commonly seen signs and symptoms, necessary investigations, and suggested management plans for medical students and everyday people. For me, this was more than just information. It was about empowerment, impact, and change. Impact can be measured in many ways. During the pandemic, we saw it through slides and statistics. But impact isn't always about numbers. It's about people. The impact of Skin for All isn't measured by page visits or social media followers, but by the lives it touches. I measure impact by the students stopping me at university, telling me how my website aided their research. I measure impact by the messages I get online from Devon and Cornwall communities sharing their stories of solidarity and hope. I measure impact by bridging the gap in my own training and competence, reminding me why representation matters. By addressing limitations within the spaces we occupy, by challenging barriers and injustices, no matter how small, we can drive meaningful change. It starts with action, starting that conversation, writing that letter, making that speech, or designing that website. Here in Cornwall, a land rooted in resilience and innovation, we know what's possible when creativity meets determination. Medicine is no different. It's steeped in tradition, but crying out for transformation. Let's create a healthcare system where every patient, regardless of their skin tone, background, or story, feels valued. This is my journey, a medical student with a dream to challenge what's already written, to innovate, and to leave a legacy. We need to foster a society of innovation, curiosity, and change, so we can create a future we can be proud of. I invite you to join me, whether you're a clinician, parent, or simply someone who believes in justice. Your efforts can create ripples. When we share our stories, we connect threads, and by doing so, we weave a strong and more inclusive future for all. And I believe that is a story worth telling. Thank you.